So how long does that process take? Like when you guys work with somebody and you're working, like, do you take them out into the woods in a tent somewhere and they just have a spiritual awakening? Like how do they figure out their vision? Like how does this work?
No, but that's a great idea. Thanks, Nick.
Yeah.
No,
Spirit quest and
well, we have conversations just like I
yeah.
am now with you about, first of all, we have to bring value to what the vision is. So they don't see it as, well, that's fluff. It's not going to do anything for me. How's that going to make it? So you have to really bring clarity into what is the value of a vision? Why is it important? And that is, what is it going to do with me? And what is it going to mean to me from day to day in the dental world? So if I have all these words together, it's not just words. I have to explain to them and work with them on what does that look like in action. So if you're saying, I want to show caring or compassion, what does that look like in the dental world? Does that mean we don't let them pay or they don't have to pay? That's compassionate, right? But no, maybe it means I'm going to, understand and empathize with you and what is important to you and your oral health, the way you see it, your perspective, and I'll have empathy for you. So it's what does it mean to you? What are these important things? How does that prioritize in you and what makes you different from other dentists and from other offices? Okay. And that's the first step, is getting them used to that, to get to a point where they can actually come up with a statement that they can refer to, because that vision statement is something that everybody agrees on or aligns with, right? Everybody sees how they contribute and they can clearly see that they're taking part in the progress and in the success of the practice. That's where the engagement comes in, right? But it also means it's a good way to be able to look back and say, okay, what am I doing right now that contributes to the vision? Let's say that a dentist, if they're coming up on a decision of, do I hire somebody else? Do I buy a piece of equipment, or I do this, right? I always say, let's look back at your vision. Where were we, 2 years ago? What were some of the things? And will that contribute to what you saw and you envisioned for your future? Does it line up, right? So those are the kind of things too that you can have, discussions with your team members about, right? Maybe there's a performance issue or a behavior issue. Okay. And it says in our vision that we care about each other and we work in a comfortable environment. Are you doing that when this happens? Right. So that's when people get a little bit more clear on, okay, now I know what this is for. But again, it's not something that you stick on a wall or put in a binder and forget about it. It should be posted for the team to see and to be reminded. And with our clients, we ask that every monthly meeting that they have, that it's recited before the meeting starts. It puts everybody on the same page, reminds everybody about why they're there, and it keeps everybody focused on the problems that we have to solve during this meeting and the things that we're going to discuss during this meeting. We're all in this together. We're all in the same boat. We all get it, right? And it's a great way to go.
Repetition is an interesting point, because basically there's countless dental practices I've spoken with, right? So one of the questions we ask in the beginning is like, what sets you apart? Like, why would I pick you? Like, if I was in the area, okay, I can go to your practice or the other 50 here. They all offer the same stuff as far as what I know, because I'm not a dentist. I can't evaluate your clinical skills. I don't know if you're a good dentist or you're just, you offer a hack job there. I don't know, right? So we ask them, like, what sets you apart? And often they don't have any clear understanding of like what is unique about them, what their unique proposition is. Like, so we usually hear, well, we treat our patients like family here. It's like, wow, I've never heard that one before, right? But the problem is when you listen to their calls, it's like, it's shocking. It's like, you guys don't treat patients like family. Like the other day, somebody called in and, wanted to book an appointment, and you told them, oh, I already turned off my computer for the day. Can you call us tomorrow? It's like, how is that? Is that how you treat your family member? That doesn't make any sense, right? I personally, my wife went to dental practice recently, and she was, waiting for her appointment. Somebody called because something about their babysitter canceled. They had a family emergency of some sort, so they couldn't make their appointment. And the receptionist was like, kind of very rude to the patient. It's like, well, it's your first appointment. This really doesn't look good, And it's like, why are you giving them a hard time? What do you expect? They're going to abandon their child to come in for their teeth cleaning? I mean, relax, okay? Like, it's not the end of the world. And after they canceled the appointment, the two receptionists spent a good 10 minutes bitching about that patient while there were four other patients waiting for their appointment in the lobby. But you ask them, it's like, well, what sets you guys apart? Oh, well, we treat patients like family here. We're really great. And it's like, are you though? And why does that happen? It's like, well, because the dentist doesn't revisit the focus of the business, the vision, the things they stand by. They read it once in a book, they did a seminar, they talked to their team once, and then it got swept under the rug. So you can't blame your team. It's not a message you continue to reiterate. So if they see that you mentioned it once and forgot about it, well, why should they take it seriously? Obviously, it's just some fluff you said today, you'll forget tomorrow, right? And it comes back to the point, like you said, it's like you start with the leader first, because there's a lot of dentists who, my practice is stressful to work in. I need a fix. I just want to sign a check. You come in and talk to them and make them better. And I'm just going to go do dentistry. It's like the problem started with you. Like, you are the first one we need to teach. And, they find that like a hard pill to swallow. But yeah, in my opinion, it's like you as the leader have to be the most involved. And then it'll actually free up your time, because people think, I don't have time for that. I don't have time to do coaching. I don't have time to do leadership training. It's like, but that's why you don't have time, because you don't have those skills.
Yeah.
Right. So, well, let me ask you this. Like, there are situations, though, where I got to say, I don't think it's the dentist. There are cases where I've seen where it's like they really just don't have good staff. They have some people that they got to get rid of. Like they might be toxic, or they might be actively trying to sabotage the business. I mean, dentistry, we've had numerous clients who, years later discovered that, their office manager was stealing money, So you've worked with a lot of dental staff members, a lot of practices. Is there a scenario where it's like, hey, if you see problem A, B, or C, trust me, 9 out of 10 times, Mr. Dentist, it's you. You're causing this. But if you see these other three things, then no, you might actually, be dealing with something where it's not that you didn't appreciate your team or you didn't do the right thing. Maybe you do have people that are actively sabotaging you.